Tummy troubles, a common worry. Almost every child experiences a tummy ache at some point. It's a common childhood complaint that can range from a mild annoyance to a more serious concern. As a parent, it's natural to feel worried when your little one is in discomfort. The good news is that most stomach aches are not serious and can be managed with simple home remedies. It's important to remember that children feel pain differently than adults. What might seem like a minor ache to you could be very real and bothersome for your child. Therefore, it's crucial to approach their complaints with empathy and understanding. There are many reasons why your child might be experiencing stomach pain. Identifying the cause is the first step towards finding the right solution. Some of the most common culprits include indigestion. Eating too quickly, consuming greasy foods, or having an upset stomach can lead to indigestion, which often manifests as pain in the upper abdomen. Constipation. When bowel movements are infrequent or difficult to pass, it can cause discomfort and pain in the lower abdomen. Trapped gas in the intestines is another common cause of stomach pain in children. It can occur due to various factors including swallowing air while eating, consuming gas-producing foods, or underlying digestive issues. Viruses. Viral infections, commonly referred to as the stomach flu, can cause a range of symptoms including stomach cramps, vomiting, and diarrhea. Fortunately, there are several things you can do at home to help relieve your child's stomach pain. Encourage rest. Sometimes all your child needs is a little rest to feel better. Let them lie down in a comfortable position and encourage them to relax. Offer fluids. Dehydration can worsen stomach pain, so make sure your child is well hydrated. Offer them small sips of water, clear broth, or an electrolyte solution throughout the day. Apply a warm compress. A warm compress placed on the abdomen can help soothe muscle cramps and relieve pain. Dietary changes. If your child has been eating heavy or greasy foods, try offering them bland, easy-to-digest options like toast, rice, or bananas. These foods can help settle their stomach. Section 4. When to call the doctor. While most stomach aches are not serious, there are times when it's essential to seek medical attention. If your child's pain is intense, persistent, or accompanied by other concerning symptoms like fever, bloody stools, or severe vomiting, it's crucial to contact your doctor immediately. If your child's symptoms don't improve after 24 hours of home care, or if they worsen, it's best to err on the side of caution and seek medical advice. If your child has a history of digestive issues, such as Crohn's disease or irritable bowel syndrome, it's important to consult their doctor for personalized guidance. Section 5. You've got this, parents. Dealing with a child in pain can be stressful, but remember that you're not alone. By staying calm, offering comfort, and following these tips, you can help your little one feel better soon. Remember to trust your instincts. If you're ever unsure about your child's condition, don't hesitate to reach out to your healthcare provider for guidance.